So this is part 2, and I'm suggesting that lying on foam rollers will increase mobility in the thoracic spine, but it's not specific enough to capture the ribs and increase mobility of the ribs. And for this reason, it can feel extremely relaxing to have your ribs mobilized in a very, very specific manner. Now we could have the client lay on their stomach. So this is their neck. This is the thoracic spine. We know that because it has ribs attaching to it. And we could come onto the ribs and do a very gentle forward gapping, an anterior pressure, and even a little bit outward pressure, forward and outward pressure, to gap the rib off the vertebral body slightly gap it off of the transverse process of the vertebrae, and allow that rib to self-adjust, whether it needs to come in closer or whether it needs to be pulled out, is easily accomplished when we simply gap that structure and impart an anterior force. What you can do is have the client lay on their back, and by having them on their back, you're weight bearing more on the thoracic spine, so that part is stable. So then when you impart forces on the ribs, much more of that force goes to that rib joint. The technique I use is to have the patient lie on their back, and I cup my fingers like this, and I come underneath the scapula, so I identify the shoulder blade and make sure that I'm inside the shoulder blade. In fact, I come and identify the spinous process as well, and then I feel for these bumps, and these bumps that are prominent are the transverse processes. So all I need to do is just come inside those little bumps, and then I'm on the ribs. So what I do is use both hands, and I come and I capture one rib, and probably a little bit of the rib above and probably a little bit of the rib below. And then I just lift it up and create a pivot, and I maintain that pivot for about 2 minutes, and that's a long time. When you're stretching, 15 seconds feels like a minute, at least to me. And so to keep myself honest, I always set a timer when I do that. And so I will come and capture what I believe to be the fourth rib and focus on that. And I may or may not also include the one above or below, depending on the person's size. After doing that 2-minute release, I come on the other side and create a release and just walk upward, because I'm starting out in the middle of the scapula. So I treat this rib for 2 minutes, come up to the next one, treat it, keep making my way up, and ultimately get to rib number 1. Now, you can also experiment with, does a medial force feel more helpful to the client, or does a lateral force feel better to the client? And it's that simple. It's a treatment that I greatly value when I have that done to me, and it's so much nicer to have this done with human hands. You can use a piece of foam and cut it smaller to where it will isolate that area. Instead of using the foam like this horizontally, you can cut a much smaller piece. Say, I would prefer to cut this in half, and then place that under the rib, inside the scapula. That noise is my puppy. But you could lay on that foam, and you could cut off a very small edge of it. So let me run and grab a bread knife and show you that. I have not seen the 4-inch diameter foam on Amazon. I haven't seen it through medical suppliers. You can contact us, or you can look at the catalog at Foam America. So it's sort of like Foam America. F-O-A-M-E-R-I-C-A. And so I'm going to cut this piece of 4-inch diameter foam at an angle, and I'm cutting it at about a 30-degree angle. Then I allow it an inch or more, inch and a half, inch to an inch and a half. That looks like inch and a quarter to me. And I cut another 30-degree. And then what I do is come on the bottom. I want to slice across so we have a flat surface on the bottom. So this becomes a very stable prop for rib mobilization. So I can take my client, have them reach over with their left arm, reach over and touch their right shoulder, and that's going to effectively pull the scapula up out of the way. And then you have them, and then you identify the spinous processes, identify these bumps, prominent bumps, which are the transverse process of the thoracic spine, and then you have them lay on that rib in between. If they bend their hips and knees, they're going to have more pressure from the viscera applied on that. And we'll try it at about 4 different locations: inside the lower scapula, inside the mid scapula, a little bit above the scapula, and then up high. Now it's really tricky to capture the first rib. I have other videos on YouTube on first rib mobilization, and I would encourage you to watch those. But a very simple mobilization is, again, the manual technique. So let's imagine I'm treating the right side of this person's rib cage. They're laying on their back. Nobody's home, so I can't use a volunteer, but you also want to see my finger placement. So I'm going to cup my hands like this, and I'm going to reach inside, feel the scapula, have them reach over and touch their left shoulder with their right hand. That'll bring their scapula out of the way. So I'll come in and I'll walk in until I feel the bumps. That is the transverse process of the thoracic spine, and then I'll come just outside of that, and then I do a very gentle lift. Now when I do that lift, I can stay there a long time if I use this kind of a grip in which the interphalangeal joints are extended. So we're bent here at the knuckle, at the metacarpal phalangeal joint, but these joints in the finger are straight. So it looks like this, and you just prop them up to a natural stop point, and then you just keep that pressure there and set your timer for 2 minutes. Now you can test pushing in a little bit, and a lot of us have rounded shoulders where those ribs have over time migrated outward a little bit. And it might feel very, very therapeutic to bring those ribs in towards the spine. So an upward force and then an added medial force at about a 30-degree angle towards the spine is probably one of the most comfortable handholds. You could also try bringing a little bit forward again, but a little bit lateral, and go with comfort. Go with whichever one of those, and you can fine tune it using very, very, very small movements. But it's a fabulous way to reduce upper neck, upper back tension. And I do refer you to other videos. You can type my last name and the word first rib, so H-E-S like Sam, C-H-F-I-R-S-T-R-I-B, and that first rib is a unique little critter, requires a little bit more finesse. So I hope this is helpful to you, and the best way to have this done to you is to first do it to someone else, and then you'll convince them of the value, and they'll request it of you, and you say, well, you got to treat me first. So I hope this is helpful to you. Thank you.